Hey everyone, my name is Coleman Mills and I am the program manager for the Duke Onco-Fertility program. Today I have two amazing providers with me that will answer several questions for us to better understand what oncofertility is, why it's such an important medical field, and something for cancer patients to consider. First, I have with me today Dr. Karen Baker, who is a urologist and a member of the Duke Onco-Fertility Steering Committee. I also have with me Dr. Kelly Achara, who is a reproductive endocrinology and infertility specialist and co-lead of the Oncofertility Steering Committee here at Duke. So the first question we have is, what is oncofertility? And we'll start with Dr. Baker.
Thanks, Coleman. So Oncofertility is a program that's aimed to help men and women preserve their reproductive options in advance of treatment, such as cancer treatment, that would threaten their ability to have children in the future. And the program can include education, logistical support, and in some cases also financial support.
So the next question is for Dr. Acharya. What do you cover in a fertility preservation consultation?
So we would discuss the possibility of freezing reproductive tissue. So for females, this may include freezing eggs or fertilized eggs, embryos. For males, this may include freezing sperm. And we would also go over if there may be other options available to somebody like medications or specialized surgeries, which may help to preserve their fertility for the future. Also, even if somebody has already had cancer treatment in the past, they may still be a candidate for having fertility preservation if they think that they're at risk for future surgery or further chemotherapy or radiation that may harm their fertility. So in general, I think it's a good idea at least to have the conversation up front.
Great. So the third question is for Dr. Baker. Explain the fertility preservation process for males.
So for men, fertility preservation boils down to cryopreserving sperm for the majority of the cases. As boys start to go through puberty and men in adulthood who are able to make a specimen, the sperm that's retrieved from that specimen can be frozen and safely stored for years, sometimes even up to decades, without any concern for the quality or number of sperm degrading. And then that sperm can be used in the future for making a pregnancy through a variety of techniques that when the couple comes into the fertility center, they would get more information about, but can include things like insemination or in vitro fertilization. This can be important because some cancer treatments, be it radiation, chemotherapy, or surgery, can impact the ability to make sperm, impact the ability to deliver sperm. And so for a man in the future, that may make it so they can't make a pregnancy. So freezing that sperm in advance of that treatment is very important for preserving that option for them into the future.
Great, thank you. And so the final item for discussion is for Dr. Acharya. So explain the fertility preservation process for females.
So the classic option we would discuss when a female comes in and is interested in preserving her fertility prior to cancer treatment would be to talk about possible egg or fertilized egg embryo freezing. So the way that process looks is typically we would meet up with the patient in a consultation. We would talk them through their individualized risk of harm to their fertility or risk to their fertility with their cancer therapy. And then if they decided to move forward with egg or embryo freezing, then we would have them start on some injections. And we can get started pretty quickly, usually within a couple days. It ends up being about 2 weeks of being on daily injections that stimulate multiple eggs in the ovaries. And then after about 10 to 14 days of those injections, then we do an office procedure where we have the patient be asleep and then we retrieve the eggs. Sometimes people call it an egg harvesting. And if the patient has a partner that she wants to fertilize the eggs with, we would fertilize the eggs at that time. And then we could freeze the eggs or embryos to be used for later.
Awesome. Well, thank you both, Dr. Baker and Dr. Acharya, for taking the time to answer these questions and provide us a better understanding of oncofertility and the fertility preservation process. For more information, call the Oncofertility Patient Navigator at 919-316-9935 or email oncofertility@dm.duke.edu.